Hi, this is Jackie Libyan with Integrated Care Leadership Network. Thank you for joining us today. The topic of our webinar is Why Aren't We Happier Helping People? And we're so excited to offer this webinar today to you guys and to introduce our guest speaker, Dr. Martin Rossman. Let me tell you a little bit about Integrated Care Leadership Network. We are a 501c3 nonprofit based in Oakland with a mission to build healthier relationships between clinicians, students, patients, and the broader community to improve care. And we are affiliated with UCSF and the Integrated Nurse Leadership Program, a 9 Bay Area hospital nurse-led collaborative that undertook quality improvement work to reduce medication administration errors and sepsis mortality. This collaborative enjoyed tremendous success. Through it, Integrated Care Leadership Network was formed, as well as the Regional Nurse Network. And so we are focused on providing innovative learning opportunities for frontline clinicians, and we're bringing you Dr. Rossman today to talk about stress. Let me tell you a little bit about Dr. Rossman. He is a physician, author, speaker, researcher, and consultant. Dr. Rossman is also a nationally board-certified acupuncturist and has practiced traditional Chinese acupuncture since 1972. He's a graduate of the University of Michigan Medical School in 1969 and has a long-standing interest in the practical importance of attitudes, beliefs, emotions, and mind-body practices in medicine and health. We're so thrilled to have him with us. He is a published author and has written the book The Worry Solution, Fighting Cancer from Within, and an award-winning self-help book entitled Guided Imagery for Self-Healing. Finally, Dr. Rossman is also the founder of the Healing Hospital Program. The Healing Hospital Program provides in-hospital guided imagery CDs for patients and staff alike to help reduce stress, alleviate pain, improve sleep, and much more. So with that, I'm going to turn it over to Dr. Rossman right now, and I hope you enjoy the webinar.
Thanks, Jackie, and welcome everybody. I am a general practice physician. I'm also an integrated medicine practitioner. I practice both general medicine and traditional Chinese acupuncture, and have combined those two things for the last 42 years. And working with a great number of people with chronic illness, the role of stress, the role of how we take care of ourselves, the role of our attitudes and beliefs and our practices in managing stress comes to be a very central issue for both the patients we work with and for us as healthcare professionals ourselves. So the title of this talk comes from something that a very good colleague and a mentor of mine said to me many years ago when I was a younger physician and kind of burned out and depressed by how difficult it was to try to help my chronic patients change the way they lived, the way they ate, their drinking, their smoking habits, their exercise habits, their stress management habits, and so on. And after kind of whining and complaining to him for what was probably an unreasonable period of time, he looked at me kindly and he said to me, you know, why aren't you happier helping people? And it was a statement that really kind of opened me up to taking a different kind of look at myself, because we are privileged and lucky as health professionals to do meaningful work and to be in a position often to be helpful to people, to relieve their suffering, sometimes to save their lives. And there are many pressures on us that I'm going to talk about today, and also want to talk about and share with you some of the perspectives and some of the skills that I have found both with me and many health professionals that I've trained over the years to help reduce that stress and renew some of that joy and satisfaction that we should be able to feel from doing our work. So I want to start with you by just taking a few minutes to let you do a brief self-assessment of where you are right now on a number of dimensions. And I'm going to ask you to use an imaginary 0 to 100 scale to answer each of these questions for yourself. You may just want to keep these numbers in mind. You may want to write them down for yourself, because it's kind of a handy way to self-monitor how you're doing managing these dimensions. So the first one, right now on a scale of 0 to 100, how healthy are you? Where would you put yourself on that scale, where 0 is very, very ill, not having any health at all, and 100 is radiant, ecstatic, overflowing good health? I mean, just kind of take some time. It's your scale. There's no right or wrong answer. Just where would you put yourself on that scale? And then the next question would be, on a similar scale, how content are you? On a 0 to 100 scale, 0 is very, very discontented. 100 is perfectly content. You couldn't think of anything you'd want to change. Third question would be, how happy are you on that same scale? 0, not happy at all. 100, overflowing with happiness. The next question I'd ask you is, how stressed are you? On a 0 to 100 scale. 0, you have no stress whatsoever. 100, you're overflowing with stress. Next question, how good are your coping skills? How well are you coping? 0 would be completely bereft of coping skills, not coping well at all. 100 is coping very, very well. And the final question I would ask you, take a look at your numbers for the other scales and just kind of sit with it for a moment. And then think about how motivated you are to improve or to change things on any of those scales. Again, 0, no motivation. 100, you're just roaring to go and just ready to make changes that will improve you on any or all of those other scales. So we're going to talk about stress. Again, stress is endemic to life. Stress is a response in the body to a demand for change. That's Hans Selye's definition. Hans Selye is the McGill physician who pretty much coined the term stress for this response in the body to a threat. That's the most fight or flight response, is the best known response. There's also a freeze response that many of us have, a little bit lesser known. But there's a big shift in our physiology when we perceive something to be stressful to us. And of course, and this young woman is walking down a dark street, and she's on guard. Her senses are sharper. Her eyes are literally, her pupils are wider. Her hearing is more acute. She's on alert for any danger in the vicinity. The blood is flowing more to her large muscles, not to, so her hands and feet might get cold because the body shuts down that flow so it can pump them into large muscles so she can run or fight for her life if she needs to. Again, her senses are heightened. Her blood pressure is up and her heart rate is up, preparing her to, again, fight or flee. She's got a big surge of adrenaline going on, which is contributing to all of these changes in the body. Her blood will clot 4 to 5 times faster in this state than it normally does, which, if you were to get mugged and injured, or in the free-living human, our ancestors living in caves, if you had to fight a saber-toothed tiger or get attacked by a predator and you got wounded, it would be to your advantage, of course, to have your blood clot 4 to 5 times faster. Those of you who see cardiology patients know that we don't want people with heart disease, hypertension, and high lipids and so on to have their blood clot 4 to 5 times faster. And it's one of the reasons that stress important aspect of clinical management of not only coronary artery disease, hypertension, but pretty much all of the major diseases of our time. We'd like to slip into a state where the blood is flowing nice and easily and going to all of the tissues and providing nutrients and oxygen. And this is a response that's built into us by nature to help us survive these kinds of threats. When the caveman or woman walked out of the cave, ran into a big predator like a tiger, this big shot of adrenaline goes through us, these catecholamines, sympathetic nervous system discharges, and it prepares us to either run faster than we've ever run in our life, or climb the highest tree, or fight this tiger and have a chance of surviving it. And one way or another in nature, this response is over in about 20 minutes. You've either outrun the tiger, or you've killed the tiger, or the tiger has eaten you for lunch. And in any case, about 20 minutes, it's all over. If you manage to survive that attack, you would kind of drag yourself back to the cage. You'd probably collapse for a while, and your body would go into a compensatory restorative phase that we usually call the relaxation response, which is physiologically the opposite of that stress response, where your body is replenishing the chemicals it's used up, where the blood is once again flowing to the digestive organs, where the body is doing clean up, fix up, paint up, and putting itself back together, restoring the amount of energy that it used during that heavy exertion for 20 minutes. And you'd probably tell the story around the campfire about how you killed the tiger, and you'd probably tell that every night around the campfire for the next 30 years, or until you died of natural causes, or your cave mates killed you because they don't want to hear the story again. But the point being, your physiology would right itself and go back to a normal baseline state. This is the response we have to what's called type 1 stress. The stress researchers have called this type 1 stress, where there's an easily identifiable source of stress. There's a response you can make in order to resolve it. And when you survive it, your body goes back into a normal physiology. Most of the stress we have in modern life is not type 1. Most of it is what the stress researchers call type 2 stress, which is all of the little things, little or big, but constant, ongoing worries, nagging worries, financial worries. Did I do all the things I need to do today? Do I have enough money to send the kids to college? Are we going to be able to afford the mortgage? Will I ever be able to retire? Will I ever be able to get out from under this particular supervisor? Or if you are a supervisor, will I ever be able to get the right staff to do this job? The economy, the environment, and I don't mean to bum you out more than you're bummed out today, but the news, most of which is bad because it sells news and gets us to watch. Most of those type 2 stresses are sort of ambient stresses. For most of them, there isn't anything that we can actually do to resolve it very quickly. We can't fight it. We can't run from it. And the thing is that the body responds to those because they're perceived stresses in a very similar way that it responds to the tiger, at somewhat of a lower level, but a much more chronic level, so that we can live in this chronically physiologically aroused state, which is ultimately depleting of energy. So I want to talk about some things we can do to manage that. So, common sources of stress for health professionals, I just want to go through this quickly. Very common, too much to do in too little time. Too much is asked for us. A lot of responsibility without seemingly enough support. Too much responsibility, too little credit, too little compensation. So many people in healthcare feel this way, doctors, nurses, psychosocial support, administrative staff, and so on and so forth. Issues of scheduling and management, what kinds of hours, what kinds of shifts, who's running the store, is it a well-run operation, does the operation take care of its employees, and so on. Compassion fatigue, just too much sadness, too much illness, too many people we can't help, especially those of you who work in a hospital setting where there's high acuity, may be exposed to lots of loss. And, we do our best to help people. We're happy when we can help people. A lot of people we can't help the way we'd like to, for a variety of reasons. And over time, that can be very draining. It can lead to burnout, getting jaded, hardening our hearts, kind of turning off our accessibility to others and to ourselves, a big source of burnout. And then, of course, we have our own families that we're concerned about and worried about. Addictions and utilization of substances is exceptionally high in the health professions. We may be drawn to stimulants to help us, get through the long hours or get through the day. We may be drawn to alcohol or other sedatives to kind of take us off whether it's the coffee or other kinds of medications or drugs we may be on because of it. And this is a very common and very dangerous thing for health professionals. And I think it's essentially a way to try to get through the day and try to manage our stress. So it's just unfortunately toxic and leads to problems of its own. Excuse me 1 minute. And then, of course, are the existential issues of being human. Life is temporary. We're all getting older. There are different challenges that come with that. So we're not immune from those things just because we're health professionals. As a matter of fact, we're exposed to them more, and they may be more in our face than the average person. And then, there are the external stressors, and then there's the way we respond to them. And actually, a huge amount of stress that we experience has to do with this cartoon, where little Ziggy says to his psychiatrist, "The figments of my imagination are out to get me." Worry is a huge, huge source of stress. So if we allow worry to take us over, because worry is a function of imagination, and a great deal of stress is a function of imagination. I wrote a whole book about this. It's called The Worry Solution, as well as a set of CDs. I'll talk about those later. Because there are stresses that are unavoidable and come to us from challenges from the outside world. But the big majority of stress that we experience every day is a result of runaway imagination. The human imagination is a remarkable mental function. And in a way, it separates us from the rest of the animal kingdom. We're the only animal we know of that can do long-term planning, problem solving the way that we can. We can imagine possible futures. We can use our imagination to anticipate danger and solve problems before they happen. And that's a great advantage, so we don't have to make the same mistakes that other people have. We can learn not only from our own mistakes, but from other people's. We could study history. We can learn from our elders and what's happened to other people. And so we can, in a sense, mentally put ourselves into the future and imagine, how would it go if I did it this way? How would it go if I did it that way? And it gives us this ability to plan, this ability to anticipate danger and solve problems in advance. So I think worry, what I call good worry, is a type of problem solving that gives humans a big advantage in the world and has resulted in us being the dominant creature on the planet. The trouble with it is that it can drive you nuts if you allow your imagination to run wild. And very few of us have actually had formal training in how to use our imagination. If you think about it, when you went to school, the emphasis is on the reading, writing, arithmetic, the 3 R's, cognitive functions, rational, logical, very, very, very important and very useful. But very, very few of us got any education in how to use our imaginations on purpose. And so people often become habitual worriers. And some people develop what I call a bad worry habit. Bad worry is imagining the future in a way that doesn't solve problems, and it actually creates problems of its own. And I'll go into that in more depth if we have time to do a longer workshop, because I think it's very critical. I think learning how to use the imagination instead of being used by your imagination is a very critical tool in stress management and learning to increase your comfort and happiness and health level and reduce your stress level. I will mention parenthetically that there's been research on how many things that people worry about come true. And you might be surprised, and you might not be, to learn that 85% of things that people worry about never come true. The problem with that is that I believe that when these things don't come true, your brain may think that they didn't come true because you worried about them. And your brain actually gets rewarded for these things not happening. It's a kind of magical thinking. It's called superstition, and there's a huge psychological literature on it. So when people worry about things and then they don't happen, there may be a reward system in the brain thinking that you fended it off by worrying about it, and so people become really habitual and almost compulsive worriers, creating stress all the time when they don't have to create stress. We'll go into that in more depth if we have a chance to do a longer workshop or seminar. So the big question here that I want to focus on is, are you using your imagination, or is it running away with you? Those are two. Your imagination is a very powerful function. It's like owning a powerful horse. It could take you across a lot of ground and take you lots of places, pull a plow and do a lot of work for you if you take good care of it and you train it. But if you just let it run wild, it can also run over you, trample you, kick you in the head. And a lot of us get kicked in the head by runaway imagination. So I want to talk a little bit about what I call Stress Management 101, sort of the basic bones of stress management. And what it really comes down to is a couple of things. One is, can you change your situation? If a situation you have is chronically stressful to you, is there anything that you can do about it? To really give that some thought. Can you remove yourself from it? Can you assert yourself in it? Do you have any power, any means of changing that situation so that it's less stressful for you? Some situations may be easier to change than you think. Other situations may be hard, and others may be impossible to change. You may just not be able to do that. Again, we can't solve every problem. If you can't change your situation, though, there's another option, which is that you can change your response to that situation. You can let it go. You can accept it. You can come to terms with it in some way. You can make peace with it. You can cry over it. You can grieve over it. But you can just write it off as something you can't do anything about. And I'm going to talk about two more possible options, but these are basically the two things that you can do about a stressful situation. Can you change the situation? If not, can you change your response? And changing your response is where skills come in, relaxation skills, meditation skills, guided imagery skills, philosophy. We'll talk about some of the particular skills, for situations where you can't change the situation. A third option, which is related to changing your response, is to change your perspective. See if you can get a bigger perspective. Back up a little bit. Sometimes we lose the forest for the trees when we're too close to a situation. So if we can, even in our mind's eye, back up a little from the situation and get a 10,000 foot view, look at it from above, look at it over a longer period of time, put it in context in terms of other situations that are very stressful. One of the things that we as health professionals get to see a lot of, we get to see people struggling with serious illnesses, difficult illnesses, difficult disabilities and challenges and so on. And it's an opportunity for us sometimes to put, not to minimize the importance of the things that are stressful to us, but to put it in a perspective. We probably see people on a daily basis who have much bigger and much more difficult problems than we do. And it gives us an opportunity to be grateful that we're not in their shoes, and it gives us an opportunity to be grateful that maybe we can be of some help to people who are struggling that way, and feel good about our ability to be kind, to be helpful, to have expertise that can do that. So maybe there's a spiritual aspect here, if you're a spiritual or religious person. Maybe there's a philosophical aspect. But and this is also a place where certain guided imagery experiences are very helpful to let you get more relaxed, go to a place where you are more open, more relaxed, get in touch with what's deeper and wiser in you, and consider situations from that perspective is often very helpful. And sometimes you'll see that there might be a way to either change the situation or change your response. And the fourth thing is to just cultivate hardiness. And what I mean by that is, if you have a stressful job, you have a stressful life, you have lots of responsibilities, they're important. If they're important to you and you need to respond to them appropriately, then we need to take care of ourselves. We can't let ourselves become ill. We can't drain away our energy. We have to pay attention to taking care of ourselves. And so cultivating hardiness is what professional athletes do. It's what professional performers do. It's high performance people have to cultivate their wellness and their health, and we are all high performance people. We need to be high performance people. So it behooves us then, are you eating well? Are you taking care of your body? Are you giving it some movement? Are you balancing your work time? Are you getting any fun time? Are you getting any time in nature? Are you spending any time with loved ones or friends? How do you counterbalance the stress of your work and your home life? Are you taking good care there? We have to be in shape, in a sense, and to deal with all of the things we see. And I think it's particularly important for health professionals because, as I always say when I train other health professionals, our job is hard. We see people in pain. We see people who are depressed. We see people who are anxious. They're afraid. They're helpless. We see people who die. We see people who have to go through lots of difficult interventions. People don't come to see us. I don't know about you. I have a wonderful practice. It's a very selected practice now. I see mostly people with chronic illness, and it's as good a practice as it could possibly be. But, people don't come in to tell me how happy they are. They don't come in to tell me how wonderfully they're doing. They will as they're getting better. But if you look at what do you encounter most of your day, so most of your day, if you're spending it with patients, is full of pain, it's full of grief, it's full of depression, it's full of anger and frustration, it's full of fear. We're exposed to these powerful human emotions all day long. And then, of course, in a setting you're asked to do things, there's lots of needs to be taken care of, and then there's the pressure of working for an organization and so on. I don't have to belabor this with you, but you need to be in shape. You need to have a place to discharge those emotions. You have to have a place to process those emotions. You would be well off if there were a spiritual connection or a philosophical connection that was meaningful to you, that helped you contain all of this difficulty and the challenges that we face. It's really hard to do by yourself, and when you feel cut off or isolated, and it's easy to let yourself get isolated, so I want to encourage you to not let that happen. That's what I mean by cultivate hardiness. Why do we need better stress management? I think, one, because we would feel a lot better. You feel a lot better if you feel like there's something you can do about a situation, and there usually is. In the larger picture in healthcare, this is a really almost hard for me to believe figure, but it comes from the National Institute for Occupational Safety and Health, that stress accounts for 75 to 90% of all primary care visits in the United States. That's stunning. It's, when you think about that, that's a huge, huge number. So, we live in a culture that doesn't value or appreciate mental health or mental health interventions. It's much more acceptable in our culture to go to the doctor with a physical complaint than it is to go to a therapist or a counselor for an emotional complaint. We don't want to be seen as crazy or weak or less than somebody else, and that may even be more common in the health professions than it is in the general population, because we want to be the helpers. We are the helpers. We see ourselves as, as above that. We'd like to be above that. And so it's even harder for us to ask for help. So when we're really stressed, when we're emotionally challenged, there's only a few ways that shows up. One is a direct expression of the emotion, which is fairly rare. Second is our behaviors, the drinking, smoking, overeating, emotional modulation with eating that we do to try to modulate that. Or physical symptomatology. Our body often is the expressor of that stress, so all kinds of pains, headaches, and neck pains and back pains. I'm not saying there aren't other causes, but stress is the huge unseen risk factor in our healthcare system. And we live in stress almost like fish live in water, so we almost take it for granted, but it is an absolutely huge factor in all of healthcare. Almost all illness is stress-related in that it's either caused by stress or aggravated by stress. Again, I'm well aware that there are other causes of illness as a doctor, or the illness itself is very stressful, and the stress and how you handle stress can either amplify or reduce the amount of suffering that goes into the illness. So it's an important part of every illness. Even if you get hit by a truck, then you're getting patched up. You're not working, you're not making money. It's very stressful. Helping those patients manage stress is going to help them heal faster and get back to their lives better. And then what I mentioned before, what I call toxic coping, adds fuel to the fire. And toxic coping, again, is the smoking and the drinking and the too much coffee and the too many donuts and the emotional eating, the lack of exercise, the kind of giving up the ability or willingness to take care of ourselves. All those things, I'm not judgmental about them. There's nothing wrong with smoking and drinking and overeating at all, except that they're toxic and they cause body burdens that over time cause illness, and in a big way. So it's not a moral thing as far as I'm concerned. It's that they're toxic and they take tolls on the body. They result in illnesses of their own that become increasingly difficult to treat. So switching gears a little, I want to talk a little bit about imagery and stress. This is some biofeedback data, and it's kind of complicated. Up on the left, on the top, is electromyogram activity. That's a level of muscle tension. On the right is, in the upper is also the neck muscles, the trapezius muscle tension. The blue line is the temperature in the periphery. There's a sensor on the person's fingers measuring their, actually that blue line is their electrodermal response. That's an electrical reaction on the skin that's usually a measure of emotional responsiveness. The red line is the temperature, which is a measure of the blood flow to the periphery, and we know that when people are stressed, that decreases and people's extremities get cold. The easiest thing to look at on this graph is as you're looking at it, the right-hand lower panel, where you see this nice even white line. That's a measure of a person's breathing. There's a strap around their chest and abdomen, and they're just sitting in this biofeedback therapist's office with this equipment on, and they're breathing naturally, normally. They're pretty relaxed. So this is a patient who has a bridge phobia. They have a phobia about driving over bridges, and they live in the San Francisco Bay Area. And that's not a great combination. That's hard to do because we've got a lot of bridges. So he's in the biofeedback therapist's office, and now the biofeedback therapist is going to ask this person just to imagine themselves on the driving over the Golden Gate Bridge. And if you look at that white line on the bottom right side, you see what happens to their breathing. That's the easiest one to look at. What happens is all of this physiology goes to pot, in a sense. This person fires off a big stress response. Their muscle tension goes up. Their peripheral temperature goes down. It's kind of reversed on this scale. But their breathing gets very shallow and up in their chest and irregular. They're scared. They're anxious because they've imagined themselves driving across the bridge. It's very potent. If any of you had any doubts that imagery and physiology are not connected, this is living proof of it. Now, if this person can learn to take control of that response, learn some abdominal breathing, some relaxation methods, and so on and so forth, they can go back to a relaxed state. And the biofeedback therapist will typically work on them until they can imagine themselves. What they usually do is cut it in chunks so they can imagine themselves just walking downstairs and seeing their car keys. They'll have that big stress response. And then if they can get back to relaxed while they're doing that, they can take the next step and imagine themselves getting in their car. They'll get stressed. This may take a dozen sessions. This may take 3 or 4 months of training and therapy. So it's hard work, but if people can learn, if this person can learn to stay relaxed while he imagines himself driving across the Golden Gate Bridge, he actually will be able to drive across the Golden Gate Bridge and get over that phobia. And it's possible to do. It takes some mental application and training. So the big skill here, in a sense, is what I call the shift, shifting your attention, learning not to let your attention be captured by the things that you fear, and that's what often happens in worry. Things that are scary capture our attention like almost nothing else. We're kind of bound to that because our brain's main function is to help us survive. So things that are scary can capture our attention. We have to learn how to take a deep breath, shift our attention because we want to something else that is, that creates a different response in ourselves. So learning how to shift your attention from your habitual thinking to other thoughts is a critical skill. It's very difficult to stop thinking. People always tell me, I can't stop my mind. My mind just keeps going on. I can't get to sleep because my mind won't stop. It's really difficult to stop the mind. The mind is a scanner. But what's possible is that to shift focus. Those of you who have ever had a 2-year-old will know what I'm talking about. You can't stop a 2-year-old. You can't make them stop. They're not going to stop. They're exploring their world. But what you can do is you can interest them in something. And you can say, instead of, banging the pot on the tile in the kitchen, you could say, oh, Johnny, look at this over here. Isn't this interesting? Look at this panda bear that Daddy got you. And they'll get just as interested in that. So you want to steer their attention to things that are leading them in a direction that you desire. The same is true of our own minds and brains. So the 2 easiest things to focus on are your breathing and a peaceful place. And this is the most common guided imagery technique that we use, is have people learn to get their breath deeper, abdominal breathing, imagine themselves going to a beautiful, peaceful place where they feel safe and comfortable, and go through all their senses. What do you see in that beautiful place? What do you imagine hearing? What do you smell? What's it feel like? What's the temperature like? What time of day is it? And at the end of this talk, I'm going to give you a link to get a free guided imagery stress relief CD that I made. No cost to you, and you can try these things out for yourself. They're very, very effective. We don't have time to do it in the hour. If we do a longer a workshop. We'll do a lot of experiential training. Again, many of you are familiar with the Serenity Prayer. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Some of you may know it from 12-step programs, but it's a very old prayer. It goes back to Roman times, actually. And this is a critical skill. What can you What can you change? What can't you change? And how do I know the difference? And how do I react to both of them? And again, this is a big focus we'll work with in a longer reaction. Because Viktor Frankl, who you know was a psychiatrist who was in the concentration camps, German concentration camps in World War II, and survived it, wrote an incredible book called Man's Search for Meaning, and studied the concentration camp survivors and tried to find out what it was that helped some people survive where other people couldn't survive, and found that meaning was incredibly important. And the way he talks about this is that forces beyond your control can take away everything you possess. That was certainly true in those camps, except for one thing: your freedom to choose how you will respond to the situation. This is the one thing people can't take away from us if we claim it. And I want to encourage you to claim it. Sources of joy and support for healthcare professionals. I left this intentionally blank. I'd like you to take some time after the workshop to fill this in for yourself. Where are your sources of support? Where are your sources of enjoyment? And I will talk a lot more about this in a longer seminar. My colleague, Dr. David Bresler, who was my co-founder of the Academy for Guided Imagery, he used to talk about people's serum fun levels. And along with things that are meaning and satisfying and so on and so forth, I want you to think about your fun level. If you had a serum fun level that we could measure, like your cholesterol level that went from 0 to 100, where would you be on that? And when I ask most of my patients that, where are you? I often use a 0 to 10 scale. Where's your serum fun level on a 0 to 10 scale? Most of them look at me with a blank face. And most adults haven't even thought about having fun for a very, very long time. I think fun is really fun. It's important, but more than that, it's fun. It's the joy of life. It's what brings you joy, what puts a smile on your face, what puts the zest in your life. What would you do just for the sake of doing it, because you just enjoy it, whether it has any redeeming qualities or not. And if your serum fun level is down, below 20 on a 100 scale, I really, really encourage you to just think about what would be fun for you and get some fun in your life. Get it up certainly above 40, and try to get it to 60. Because it makes the rest of the stuff worthwhile. You can include stuff here that's satisfying and meaningful to you and that you feel good about as a person. Those are all very important. But I also want you to just think about stuff that's fun. It's like nonsense. It doesn't help anybody necessarily. It doesn't do anybody any good. You don't have to have any redeeming qualities. It's just fun. And if you don't have anything in your life like that, I want you to think about doing that as your first stress reduction thing. See if you can get your serum fun level up above a 4 on a 10 scale. But also be grateful for the things that people, the things, the activities, the organizations, the abilities you have. The gratitude journal, taking some time each night to write down at least one and hopefully 3 or more things that you're grateful for that you experienced that day, is a great counter-irritant to the stresses of the day, so that you don't go to sleep dreading tomorrow or dreading that you won't be able to sleep. Take some time to sit down and think about the things that you're grateful for and really cherish them and think about them and feel them. And then also get your serum fun levels up. This is an illustration I like to use when I talk to, we always talk to people, especially helping professionals. There's a lot of codependency. We like to help people. We can help people to the detriment of helping ourselves. And we often talk to people about, putting your own oxygen mask on in the plane when it comes down, and they always tell you, put your own mask on first before you help anybody else. Help your little kids and your old people. That's a good lesson. The other one comes from Mother Nature herself, and it is the way that the heart takes care of itself. And here's the aorta and the big arteries that take the blood to the brain. Of course, the heart pumps blood to every cell in the body, and if it stops, we die. So it has huge responsibility, and it goes on beating our whole life long, pumping that fresh, oxygenated, nutrient-rich blood out to every cell of the body. But look what it does first. Where's the very first blood go from the heart? It goes into the coronary arteries. So it takes a little sip of the freshest, most highly oxygenated blood, goes right back to the heart. Because if it doesn't, it can't provide for everybody else. This is Mother Nature's design. It's not a pig. It's not taking a huge amount of blood. It's not taking all the blood and saying you can't have any. It just takes enough blood to nourish itself, keep itself rich in oxygen, rich in nutrients, keep itself healthy, and then it can send the blood out to all of the other organs, all of the other tissues, all of the other cells. I want you to think about this and take it literally to heart. This is how we're designed. No matter how good a person you are, you need to take care of yourself, if for no other reason than if you don't take care of yourself, you can't take care of anybody else. And this is my absolute favorite. I call it the Codependent Creed. I think it's brilliant. Due to circumstances beyond our control, we are masters of our fate and captains of our soul. There is nobody else who will do this for you. There just isn't anyone else who will do this for you. There may be people who would be willing to do it for you, but they can't do it for you because they can't control your mind. They can't learn how to use your mind. They can't make choices and decisions for you. They'll try to, and if you let everybody else make those choices and decisions, you'll end up probably pretty depleted and burned out because everybody wants your time and attention. It's the most valuable thing we can give somebody is our time and attention. So make sure that you get that little sip on a regular basis, that you have some time, pay yourself the kind of loving and nourishing attention that you need, that invigorates you, that gives you enjoyment in life, gives you zest for life, gives you some gratitude, allows you to be happier helping people. These are some of the CDs, the audio CDs that teach relaxation and guided imagery. They're on my website at thehealingmind.org. We have stress relief, relaxing into healing, the worry solution, sleep, pain, anxiety, preparing for surgery, preparing for childbirth, headache, asthma. There's a lot of resources here. They're inexpensive. They're about $15, $16 a piece. Take a look at thehealingmind.org. And play with these things for a while. You'll get a lot of. They're simple, they're inexpensive, they're non-toxic, and they're helpful. And for you today, for spending this time with me, I want to give you a free download of the Stress Relief CD. It'll be an audio download. Go to thehealingmind.org and go through the payment process. You'll go to the checkout page, and it'll ask you for a coupon code. And if you use this coupon, ICLN capitals 618, that's today's date, this is good for the next week. If you put in that coupon, you'll be charged no money. And you'll be able to download that Stress Relief CD. It has information about stress, and it has breathing exercises, body relaxation, going to a peaceful place, solving problems. It's a very useful CD. And I hope you find it useful. And I hope you will take good care of yourself the way you take good care of others. And I'm going to hand you back to Jackie.
Thank you so much, Dr. Rossman, for sharing your incredible wisdom with us today on such an important topic. I encourage each of you to just take pause for a moment before you resume your daily activities and consider, how will you integrate what you've learned today to decrease your stress levels and increase your happiness and your joy and your health? Thank you so much for joining us, and we wish you all the best.